So what I'd like to talk to you a little bit about today, it's hard to cover in the span that we have every single procedure and all the ins and outs of the procedures, but I'd like to talk to you a little bit about one topic in particular, which is dental implants, okay? Probably most everybody in the room at some point or another has either heard or seen something about dental implants. So I wanted to spend a few minutes going over what they are, why I think our office is different, and how we can help our patients. So dental implants are basically small titanium screws that can be placed into the jawbone. Once they're placed into the jawbone, the bone in your jaw grows tightly around the threads on those screws. And once they are fastened to the bone, once they become fused with the bone, we can use those implants to fasten anything we want. We can fasten a single tooth or a crown. We can fasten multiple teeth into a bridge, and those are both fixed in place and not removable by the patient. Or, for somebody who already has a denture and wants something that is more secure, we can fasten even an existing denture to the implants. Now, I've been doing this for just about 20 years. I've been in Florida since 1992. And most people who wear dentures, and I'm sure everyone in this room either might wear or knows somebody or had a family member or whether it was a parent, I hear it all the time, who has worn dentures. I will tell you the single greatest thing that I can do in my office to help a patient is to go ahead and to take a denture that they have, especially the lower denture, and secure it with dental implants. Studies have consistently shown that when you lose your teeth, at the very, very best, your ability to chew your food in terms of the strength and the efficiency is about 20% of what it is when you actually go ahead and have your own teeth. 20%. It means that you can't chew the foods that you once ate. It means that you're the last one sitting at the table eating. You have to be careful what you eat. You have to swallow your food in larger pieces, which can lead to all sorts of digestive problems. It's a real problem in our population, it really is. But thankfully, we have a solution which not only we know works, which is very predictable, and by today's standards is so simple and so routine that it literally, if I can do one thing all day, every day, this is what I would want to do, because patients leave your office ecstatic. And if I have somebody who wears a full set of dentures, and I place 2 or 3 implants on their lower jaw, the first thing that they say to me when they leave my office, besides hugging me, kissing, and thanking me, is what would be involved to do the same thing on the upper jaw. Because now all of a sudden, the upper denture that seemed great now becomes the weak link in their mouth. And I said this before, and this is true, the single greatest benefit of dental implants for me, for Dr. Merino, and for our patients is that they work. Implants have a success rate of close to 99% in the body. 99%. I would venture to say that probably makes them the single most successful medical or dental procedure that can be done. Now, I want to talk really briefly about some of the misconceptions about dental implants because I hear them every day. I'm too old, okay? I've had people in their 60s and 70s actually say that they're too old to me. We've done implants in our office on people who are 95 and 96 years old. Anybody who's in good health and who has the available bone is a candidate for dental implants. I've heard they don't work. Well, I've already talked about the fact that they have 99% success rates. And if done properly by a skilled surgeon with proper planning, they do work. And I've heard they're painful. I will tell you with the techniques that are available today, especially with the use of CAT scans that we have available in our office, having an extraction done, a tooth extraction, is more involved and more difficult than having a dental implant placed. And my patients will tell me that routinely, and they'll say it was no worse than having an extraction done. I talked about having a CAT scan. My office is equipped with a 3-dimensional CAT scan machine. Anybody who is considering having dental implants done, in my mind, this should be the standard that every dentist should follow. If you're going to go ahead and place something into your jawbone and you have the ability to have a three-dimensional x-ray of the bone before you do any procedure, it's no different than having open heart surgery without having a chest film, without having a stress test, without having an EKG. You would never dream of it in your entire life. Yet, routinely, dentists are placing implants without having this type of information available. On every single implant that we do in our practice, we do a three-dimensional CAT scan that is included at no charge to the patient to make sure that the success of the case is as precise as it can be. The CAT scan gives you images that lets you look at the bone in a three-dimensional fashion. It allows you to measure the depth of the bone, the width of the bone, the length of the bone. It eliminates the guesswork from doing implant surgeries. It also allows us to fabricate for the patients devices that can rest over the jawbone. This is called a surgical template, a surgical guide. It allows implants to be placed without having to cut the gums. We're allowed to basically place the implant through the gums into the bone without having to even make an incision, which means that the healing that you have literally is ridiculously easy. Whereas before you had to worry about cutting the gums and placing sutures, we literally have the ability to do this, that you have a little tiny 3 to 4 millimeter hole in the gums that closes over in the matter of a day. I would imagine it's no worse than having a pizza burn in your mouth that might last for a day. It is literally that simple and that precise. It does say advantages of dental implants. I'm not going to go into all of them because there's many and there's probably even more that I've listed on the slide. But if I could really give you a few that I really think are really worthwhile to remember today, implants work. They are a tremendous investment to make in your health and in your mouth. And once they integrate, once they fuse with the bone, implants, if taken care of, can last you a lifetime. So you talk about making an investment in something that is predictable and lasts you literally forever. It's the best investment you can make in your dental health. We have an elderly woman. She's skydiving. She's enjoying it. Grandmother. And all of a sudden, whoop, I don't know if anybody saw that, the teeth went flying. Here we go, nice slow motion. And, yep, there we go. Right out of the mouth. Now, I think she had a LoJack system installed on her dentures before that, so maybe they recovered the teeth. Okay, so we talked about treatment options. Single crowns we can do. Can't even tell that it's an implant. You can do bridges. Can't even tell it's an implant. It looks natural. Or we can do full dentures by connecting patients' existing dentures, or if those dentures are deficient, we can make a new set of dentures using implants. On the upper jaw, when we do implants, we actually can eliminate covering the roof of the mouth with the denture, which actually can improve your speech and makes your food taste like food again. Okay, so why choose us? There's a lot of dentists out there, besides the fact that we're specialists. I will tell you that between Dr. Merino and I, we have a combined 25 years of experience doing this and have successfully done thousands and thousands of implant procedures successfully. I will tell you, the son of a dentist, you will not find a dentist who cares more about the results for their patient and will work harder than me, and that I can guarantee you. We're ethical. Okay? We are going to give you an honest opinion. Whether or not you want to hear it, I can't help it, but no one is ever going to leave my office without saying that I was absolutely 100% honest, and I will never do something in a patient's mouth that I do not think is predictable. I only want to do treatment. I only want to be paid for things that I think are going to work for people. I don't want anybody making a poor investment in my office. We have tremendous convenience, okay, especially when it comes to dental implants. We have the CAT scan machine in our office. We do the surgery in our office. We do the bridges or the dentures in our office, and we have our own lab in the office to control every single thing we do. So I don't have the excuse of the lab messed it up. I don't have the excuse of I didn't have the proper x-ray equipment. Every single step from start to finish is done right in my office. Thank you for joining us today.